Hello everyone, this is Megan Dykes and I'm a junior at Chestnut Hill College. I'd like to tell you a true story that is dear to my heart. When our 6.5-year-old black lab named Max was 4, he was diagnosed with diabetes. At this time, no one in our family realized that a dog could get this disease. It doesn't matter how expensive a pet is or that you went to a well-known breeder. The fact is, this disease is genetic, meaning that one of his parents had to be diabetic to pass it on. These past couple years, my family has learned a lot of information concerning dogs with diabetes. I will be introducing and interviewing my father, Don Dykes, later, who will be able to explain more about this disease. Not only is it important for Max to get his exercise for health reasons, but to also interact with his other four-legged friends at the park. Chasing the ball up and down the hill not only keeps his mind focused, but also helps strengthen the muscles in his legs. I'm here today at Pricketts Mill Park in Tabernacle, New Jersey with my dog Max and with my dad. Dad, could you explain why it's so important that you come here?
Well, exercise is very important in the life of a large dog, especially a large dog with diabetes.
When and how did you first realize that there was something wrong with Max?
Max was very easy to house train, and when he started drinking excessive amounts of water when he was about 4 years old, started wetting his crate, we realized something was the matter, so we took him to the vet.
While taking the insulin, has Max experienced any dangerous side effects?
Yes, there's been 3 occurrences over the past 2 years where he's gone into convulsions because the blood sugars dropped too low. That's why I always carry a little sugar with me in case of emergency. I can give him first aid.
Can you explain why it's so important for him to get daily exercise?
Well, exercise is very important for a large dog. When it comes to diabetes, exercise is very important in maintaining proper weight and proper sugar levels.
How heavy was Max prior to becoming diabetic?
He was about 100 pounds.
So with now, what would his weight be now?
He fluctuates between 88 and 92 pounds.
Okay. How often do you have to take Max to get his blood sugar taken at the vets?
Usually take him about once a month.
Could you give me a round estimate as to how much it would cost for approximately a year to take care of Max?
If we factor in the insulin, the syringes, the doctor's visits, and the special prescription food and treats, we're looking at about $3,000, $3,500 a year.
Well, obviously we do this because we love him and he is part of our family. So thank you so much, Dad.
Thank you.
If we are traveling out of town as a family, Max can be boarded at our veterinarians. There's always someone on Dr. Pettit's staff that is capable of giving him his shots while he is staying there. As seen here, Max comes to this office once a month to have his BG or blood glucose level tested. He is normally calm while getting this procedure done. It's comforting to know that the doctor and staff treat Max like he is treated at home. He is probably the only dog that wags his tail and is happy to go to the vet's office. Of course, he is probably happy because he always knows he will get a treat. Dad, what will you be demonstrating for us today?
How to properly feed and administer insulin to a diabetic dog.
Why do you feel it's important to share this with us?
Well, Max was diagnosed with diabetes at 4 years old. We want to demonstrate that just because a pet has diabetes doesn't mean that it's the end of their life. They can lead a productive, happy life through the use of insulin and proper feeding.
What materials do you need to get started?
Well, I have them displayed here. We have a special diabetic food, which is the prescription diet WD, prescribed by our veterinarian. We have the syringes to administer the insulin. I'll get out the insulin in a minute because it has to be refrigerated. And then I'll show how to properly dispose of the syringes according to New Jersey law after we're done the administering the insulin.
What kind of skills do you need to give him a shot?
Patience and understanding. At first, he didn't realize what we were doing and that we were trying to help him. All he felt was pain with the administering of the shot. As I'll demonstrate in a couple minutes, what we do is we make it sort of a benefit reward type exercise in which he gets a treat after I give him the shot.
What would happen if Max wasn't given his shot at all after he's eaten?
Well, short term, since he's been on the insulin, probably nothing. If we totally stop the insulin, his body will start to react over the course of about a week or two, and his organs will fail.
How long does it normally take to set up the shot? Could you show that to us?
Couple minutes. Why don't we feed him?
Sure.
I'll prepare his shot. Preparing the shot, what I do is inject 20 units of air into the bottle. You don't want to produce any bubbles. You flip the bottle over, and then what I'm going to do is slowly draw the insulin into the syringe until I have 20 units. Well, actually, I do a little more. I go down to 25, hit a little to get the air bubbles out, and then put the excess into the bottle so I have exactly 20 units, which is his dose at this particular point in time.
So it does change, and it's not 20 all the time.
No, it's not. In fact, that's why we have to take him monthly to the doctor in order to get his blood sugar tested.
Have you ever had to give him more than 25 units?
At one point it was 30, and it's been as low as 15.
Okay. And that's one of his...
This is Pet. He also gets vitamins. I use this in the morning as a reward for him to get a shot. At night I use a regular diabetic treat from Prescription Diet.
Now, how much does insulin actually cost like this?
This is $24.88 a vial. You can buy this over the counter at Walmart. The syringes are also from Walmart. They're $12.99, and I do need a prescription. This is prescription only.
So is there a particular kind that Max needs of insulin, or is it just the same as humans?
Human and insulin. You know what? I can show you right now what we do with the shot when we're done.
Okay.
What we do is, according to state law, it cannot be thrown away with the needle. It has to be in a clearly marked bottle. And the reason being, you don't want any sanitation workers getting stabbed with this. Safety first. What we do is clip this off with a needle clipper. Then I put it in the container, and when the container's filled, I tape this shut so it can't come loose, and then I throw it right into regular trash. And it's clearly marked, according to state law, syringes do not recycle. So if a sanitation worker does see this, they know that it's not recyclable if they see the container.
So this is basically a way of cleaning up after you give him a shot.
Yes, yes. And everything's regulated by the state of New Jersey. Everything's on the state website.
Has there ever been a time where you've administered the shot to him already and it's been taken again twice in the same day?
Yes, and that's dangerous. Then he has to immediately get to the veterinary office, and they have to start purging his blood of the insulin.
Okay.
So an IV shot, IV drip all day, which is very expensive.
Right. All right. Well, I guess we'll continue on to his shot. This is where Max knows that he has to go and lay down and get his shot. So we'll come right over here.
Come on, boy. Come on. What I do is put the treat down at his head. That's it. He lays down. And what you want to do is get the fat off his back. Put it in, make sure it's in, and put the syringe in. As soon as I'm done, he knows he can have his treat. So it's a reward. What I also do is take my hand and rub his back. That's to comfort him and let him know he's a good boy. And also, I smell my hand. And the insulin has a very distinct smell. So if you don't smell the insulin, you know he's gotten a good shot and he's good for 12 hours.
All right, that sounds good, Dad.
And he's a good boy, ought to be.
Well, thank you very much, Dad, for showing us how to give a dog insulin.
Well, thank you very much, and it's just very important for everyone to know that just because a dog has an illness doesn't mean that it has to be put down. He was only 4 years old when he was diagnosed with insulin. He's almost 7 now, so he's had 3 very good years, and hopefully he'll have about 5 more good years.
All right, thanks, Dad. As long as there are tennis balls, sticks, or squirrels to chase after, he is one happy boy. When he sees my bags near the front door, he knows I'm going back to school and loves to jump in the car and ride with us. In the past couple years, while playing at Chestnut Hill College, students and faculty alike have mistaken Max for Casca. Just as author Josh Billings has said, a dog is the only thing that loves you before he loves himself. With Max being part of our family, I know that this is true. I hope that I passed along some useful information. Many people don't realize what an emotional and financial commitment it is to take care of a diabetic dog. Max is one of the sweetest and most loyal pets. Without having a voice and to know what he is going through, he is always happy and wagging his tail. It's like somehow he knows by making this commitment, we've extended his life. Thank you for taking the time to listen to this heartfelt story. Until next time, this is Megan Dykes for GTV. Have a good night.